Good morning. Good morning. Oh, I love it. I love it. Good morning, everyone. I am so happy to see you all. My name is Nicole Austin Hillary, and I'm the president and CEO of the Congressional Black Caucus Foundation. Welcome to our Health Summit, part of our Policy for the People series. We are excited to have you here with us this morning. And I can tell I've been involved in conversations with many of you as you've been eating your breakfast sandwiches. I know you all are ready to go and have this critically important conversation about health issues in the Black community. It is the perfect time and the perfect opportunity, and we are grateful for your presence here with us this morning. You know, at the Congressional Black Caucus Foundation, we envision a world in which people are empowered, where there is economic empowerment, empowerment around education, housing, and empowerment when it comes to health care, opportunities, and protection and safety in our communities. With that as our charge, I welcome you to our Policy for the People Health Summit, Health Equity Summit today. Through the various panel discussions you're going to be involved in and the breakouts, you are going to get a variety of information. We wanted to make sure that we were going to be offering you everything that you need when it comes to this crucially important topic. And we all know that in year 3 of a pandemic, that the issues of health disparities, health care are even more relevant, particularly to the Black community. And many of us knew this. So many of us knew from our work that these communities were at risk and that these communities didn't necessarily get the services that they deserve. But now the rest of the country and the rest of the world knows it. And so we have a charge to make sure that we are utilizing this opportunity to find out how we solve these issues, how we provide equity, and how we provide access for as many people as possible. Now, we know those issues are very complicated, the issues around disparities and treatment. These are structural issues. The National Alliance on Mental Illness, for instance, says that Black Americans are 20% more likely to experience serious mental health problems than the general population. Black Americans, we know, also face barriers when it comes to accessing mental health treatment. There are self-imposed stigmas, there's lack of insurance, there's a shortage of mental health providers in these communities. These are some of the critical issues that we will be tackling today. But this is just one of those issues. We know that there are many more, and the list is growing. But even as that list grows, with your help and your partnerships, we are going to be prepared to tackle and address those issues. Now, today's summit is your opportunity to engage with us, to engage with the members who are here, and to have meaningful discussions on healthcare with experts from around the country. We are going to be targeting the solutions to these problems. We have business leaders here in the room with us, as well as our elected officials and members of the community who care and want to make sure that they have an impact and can make a difference. So we are truly honored to have you with us here today, and we cannot wait to get started. Now, here's my charge to you all. May we all be empowered and equipped with the latest information to make a difference in our communities. You know that saying, knowledge is power. Those are not just pretty words. It is the truth. Knowledge is power, and it makes a difference. And we hope that each of you will leave here more powerful today to make changes exactly where you sit in the communities in which you live and with respect to the businesses that you serve. We know that a continued community approach to health equity recognizes that health outcomes are influenced by social, economic, and environmental factors that extend beyond individual behaviors and medical care. A community approach to health equity is what we believe is the solution, and that's what we'll be talking about today. Now, I want to give a special thank you to our title sponsor, Johnson & Johnson. Please join me in applauding. Without their support, this would not be possible. It takes leadership in corporate America to work with us to make certain that we can address these critically important issues. And you're going to hear from a special guest from Johnson & Johnson in a moment. But before that, I'd like to also take a moment to thank some of the other sponsors who made today possible. That includes Gilead Sciences, Fresenius, LHC Group, Genentech, Artilix, and Harmony Biosciences. Please join me in thanking those sponsors as well. Now, please allow me the honor and the privilege of introducing Dr. Lamont Bryant. Dr. Bryant serves as the head of regulatory affairs for Ethicon Head Gross Profit Initiatives. That's a long title, so that y'all know that means he's about the business. He is with Johnson & Johnson MedTech Research. So please join me in welcoming Dr. Lamont Bryant to the stage.
That's kind of difficult to be able to follow someone like that. But if I can take a step back, we were talking earlier, we were trying to figure out how could we harness the energy in the room, all the connections that were being made on behalf of our customers and our patients. So first of all, before I introduce myself, I'd like to say thank you for all you do, all the folks that you love, and thanks for the communities that you support. My name is Lamont Bryant. Again, on behalf of Johnson & Johnson and the rest of the team, I'd like to introduce myself and kind of get into a little bit of dialogue. As she said, I am Global Vice President for Ethicon's Regulatory Affairs Organization. I'm also head of our Value Creation and Gross Profit Organization and MedTech Research and Development, both subsidiaries of Johnson & Johnson, a company where we focus on delivering innovative technologies to better diagnose, treat, and improve patient outcomes. It's an honor for me to be here to continue to strengthen the relationship with all of the partner organizations as well as the Congressional Black Caucus, and to support today's Health Summit. I'd like to recognize a few people. CBC Chairman Stephen Horsford. CBCF Board Chairwoman Terry Sewell. CBC Health Brain Trust Chairwoman Robin Kelly. And I'd like to thank you for your tireless work and just continue to support patients in the communities in which we live and work. I would also like to thank CBCF President and CEO Nicole Austin Hillary for the opportunity to be able to discuss a topic that's very dear to our hearts, healthcare disparities. Research has shown that Black Americans live on average 3.6 years less than our white counterparts. And if you look here in DC, that number increases to 10 years less than our counterparts. Furthermore, Black Americans are twice as likely than white Americans to be insured. And unfortunately, Black women die at a rate of 3 times more from childbirth than their white counterparts. Healthcare should not be a privilege for a few, but it should be a right for everyone. As the most diversified and only healthcare products company that's committed to blending our pharmaceutical technologies with our medical technologies to profoundly impact health for humanity, we continue to reflect on our commitment as outlined in our credo. We're responsible for the communities in which we live and work, and also to the world community. As part of these efforts, we're working to eradicate racial health inequities around the world and address the harsh reality that Black, Indigenous, and people of color communities know all too well, that the color of your skin often determines your access to healthcare, your quality of care, and health outcomes. Closing the racial health gap is a mission shared by our long-standing partners at CBCF, which is why we're proud to support CBCF's Congressional Fellows Program, the annual legislative conference, as well as today's Health Summit. Working alongside CBCF, we are committed to using our scale and size to address health inequities in the communities that we serve. 3 years ago, Johnson & Johnson launched our Race to Health Equity by committing $100 million over 5 years in the US to promote health equity solutions. Through this initiative, we are working to rebuild healthcare from a diverse perspective. Building a diverse healthcare workforce to cultivate and innovative solutions. Within Johnson & Johnson, that means diverse teams by pledging to achieve 50%, it's okay, by pledging to achieve 50% growth in our Black and African-American leaders at our manager level and above. We're also investing in supporting community-based care models to drive healthier outcomes that include communities of color, and their role in developing safe and effective treatments. Finally, we're creating enduring alliances and encouraging everyone to join our Race to Health Equity. At J&J, equity is personal. I am the co-chair of our African Ancestry Leadership Council. It's one of our employee resource groups. One of the focuses that we have, in addition to our internal focus, is also going out in the community and working with community leaders to educate on the critical need for Black and diverse patients to engage in clinical trials. Diversity in clinical trials matter. Data and insights from historically marginalized people help inform and develop safe and effective treatments. We've made this a priority by conducting clinical trials in our company that launched. We also launched an initiative called Research Includes Me. It's an educational website about clinical research with a focus on reaching historically underrepresented populations. And we're also partnering with organizations like the National Medical Fellowship to increase the number of Black and Brown clinicians who serve as research managers and engage with other investigators. Another J&J priority is helping provide communities of color with resources to prioritize their healthcare. Unfortunately, more than a third of adults in the US have delayed healthcare, including half of the adults who live in urban communities. Black Americans cited issues related to transportation, nervousness, length of time to schedule appointments as barriers. To address this challenge, we also launched My Health Can't Wait, a community wellness initiative and resource hub that provides patients and providers with tools to stay connected and prioritize their healthcare. But we know there's so much more work to be done. Creating real equity and access cannot just happen in a vacuum or with one entity or one partnership. We believe that by working together across public, private, and social sectors, and leading by example, sharing lessons learned, and co-creating solutions, we can achieve better outcomes. We are grateful for the partnership of CBCF and the work and commitment of all the leaders here today. Let's rebuild the culture of healthcare together so that every one of us and our future generations can live longer, healthier lives. Thank you.
Yeah. We're going to take a quick picture with him while you're introducing.
Take a picture with you, three of us. You know, thank you so much, Dr. Bryant. You know, I remember, I don't know about the rest of you, when I was in college, I didn't like math. I'm sorry for all you science and math people out there. I just didn't like math. But I remember, I told one of my professors, I said, I'm going to be a lawyer. I don't need math. I don't need numbers. And he kind of chuckled. He's like, yeah, you just wait and see. And one of the things that I learned from my years working on the social justice issues that we work on and that we're here to talk about today is that numbers matter. Data matters. All of those things that Dr. Bryant just talked about, that brings to life these issues that we are here to tackle today. So nobody tell my professor that he was right. But he was like, lawyer or whatever you do, you're gonna need this information. So again, as I said at the start of this conversation, knowledge is power. So thank you, Dr. Bryant, for bringing that to us. I'm truly inspired by listening to you. And I thank you again to all of our guests who are gathered here, to our panelists, to our moderators. You all are going to bring these discussions to life. And I cannot go on without thanking incredibly important people without whom this would not be possible. And that is the amazing team at the Congressional Black Caucus Foundation. Wave your hands, CBCF team, so people know the incredible people that you are. I tell people all the time, I get to stand up here and say nice things to you, but I am nothing without those amazing people who stand side by side with me doing this work. So thank you to our amazing team and to our board chair, Representative Terry Sewell, who you will hear from shortly, and of course our CBC chair and our chair for today, Representative Kathy. Thank you so much. So look, during the opening roundtable that you are about to hear, and you are going to hear from the members, what better way to kick off this morning than hearing from the leaders who are committed to bringing these issues to the forefront in the work that they do every day on Capitol Hill. That's why they are there. That's what they are committed to. So we thought nothing more fitting for today than to have those members talk directly to you. So you're going to hear them talk about the work of the Congressional Black Caucus. These are the leaders who are currently focusing on the health disparities and these issues. They're going to talk to you about the progress. They're going to talk to you about legislation and about further opportunities for community engagement. They are also going to reflect on the state of Black health and share their preliminary thoughts and on approaches to culturally competent care. I know that's a phrase many of you are familiar with, so we'll talk more about that. So without further ado, I am honored to introduce CBC member from our board chair, Congresswoman Terry Sewell, who represents Alabama's 7th Congressional District, and she is the chair of our Congressional Black Caucus Foundation Board of Directors. Before joining Congress, Representative Terry Sewell worked as an attorney and also served as a member of President Obama's National Finance Committee. In Congress, she serves on the House Ways and Means Committee, which oversees tax policy and other economic issues. And we all know health is an economic issue. Representative Sewell is a strong advocate for civil rights, voting rights, healthcare reforms, and economic development in her district, but not just in her district. She is a leader for the country. These are issues she cares about all across America. She has sponsored legislation to expand voting rights, to increase access to affordable healthcare, and to promote economic growth in rural communities. She is also a member of the Congressional Black Caucus, of course, and has been a leading voice on issues affecting African Americans and other marginalized communities throughout the country. And I also have to tell you all, she travels as well throughout the world. So these are issues, she knows these are global issues. If you don't understand that link, then we'll have a sidebar conversation. She is a leader who knows this. So Representative Terry Sewell, please join us, and thank you for your continued support and for being here leading the charge today. So please welcome Representative Terry.
Thank you. Good morning, everyone. Good morning. I'm Congresswoman Sewell, and I proudly represent Alabama's 7th District, which includes the amazing historic cities of Birmingham, Montgomery, my hometown of Selma, Alabama, and we call ourselves America's Civil Rights District. My job each and every day is not just to represent the amazing people who make up my district. Many vulnerable communities are in my district, and I get to also make sure that I protect the legacy that is my district. And that is a powerful legacy of civil rights, civil liberties, and voting rights. So it's an honor every day. It's also an honor for me to stand before you as the chair of the Congressional Black Caucus Foundation. It is on behalf of the Congressional Black Caucus Foundation that I welcome you to our 2023 Policy for the People Health Equity Summit. We are so grateful that you have chosen to spend your time with us. The CBCF board is dedicated to supporting the foundation, our stakeholders, and the many beneficiaries of our programs. We are committed to the CBCF's mission of advancing the global Black community by developing leaders, informing policy, and educating the public. When on the CBCF board, we on the CBCF board are passionate about ensuring the lives of our community and the diaspora. Indeed, it is through conversations like these that we foster a great opportunity to make an impact, not just here, but all around the world, and definitely in the African diaspora. As the CBCF continues its work of building a more equitable world, the board of directors continue to aid and guide their efforts. Our vision is a world where all communities have an equal voice in public policy, and we applaud every effort, tactic, and strategy towards that end. Today's Health Equity Summit is just one of the ways in which CBCF works to inform our community, empower them with knowledge, and of course, aid them with advocacy. The conversations we're having today will help to build our collective vision. It is our duty as policymakers to actively engage with community members in effective and meaningful ways, and to value the opinions and experiences of those who have been impacted by our decision. I'm going to go off script, and I'm going to tell you that we in the Congressional Caucus, Black Caucus, benefit every day from the sharp, wonderful minds of the fellows, interns that are right here who, and if you're an intern for the CBCF or a fellow from the CBCF, please stand up, because this is why we do this work. Stand.
My staffer was a fellow.
And if you were an intern for CBCF or a health fellow or a scholarship recipient, and you now work for a member of Congress, stand up. Our reach is wide, and this is why we do the work. We do the work to inform and advocate on all the issues that affect our communities, but we also develop leaders. Black excellence is what we're looking for. And so with that, I also wanted to say to Johnson & Johnson, my health fellow last year was from J&J, and she was awesome. She's now got her PhD, she's running the world, but I just want you to know that your advocacy, your sponsorship, all of you, your sponsorship matters. It really matters. So when we call you up and we ask you to sponsor just a little bit more, please say yes. Now I will introduce my dear friend, Congressman Stephen Horsford, chair of the Congressional Black Caucus and representative of Nevada's 4th Congressional District. Congressman Horsford serves on the powerful House Financial Services Committee and the House Armed Services Committee. He's also, will soon be, another member of the Ways and Means Committee, which he served on in the 116th and 117th Congress. He is a strong advocate for expanding access to healthcare and improving public education and protecting civil rights and voting rights. Congressman Horsford is committed to serving the people of his district and fighting for policies all around. He has been an amazing chair of the Congressional Black Caucus, and be on the lookout for our summer of activity and activism as we tackle and wait for the Supreme Court to deal with several cases, whether it's affirmative action, whether it's voting rights and redistricting, but we plan on fighting for our people and, most importantly, for our constituents. With that, I'd like to bring to the table or to the podium Stephen Horsford, my friend.
Good morning. I'm so excited to be here. I want to thank my colleagues, Representative Terry Sewell, the chair of the foundation, and Representative Robin Kelly, who chairs the Health Brain Trust. I'm here because they told me to be here. And I heard that former Congressman G.K. Butterfield is also in attendance, and other members who may be coming through. I am Stephen Horsford. I represent Nevada's 4th district, which is Las Vegas, a part of Las Vegas, but my district covers 50,000 square miles throughout the state of Nevada, a lot of rural and underserved communities. And I'm proud to work as a member fighting for healthcare and opportunities for everyone, and to be able to work with my colleagues in the Congressional Black Caucus to specifically advance health equity for Black Americans. Because we understand when we lift up Black people, we lift up everybody. I'm honored to join you all today for the Congressional Black Caucus's Foundation Policy for the People Health Summit. And I'm really excited about the work that you all will be sharing today. I want to thank Nicole Austin Hillary and Lamont Bryant for leading us in this important conversation today, as well as all of you for your experience, your lived experience, and the expertise and the background that each of you are contributing. As a legislator, I know that policies impact people's lives in real and tangible ways. I know how important it is to ensure that policies are developed with input and feedback from the communities in which they are meant to serve. In fact, the CBC understands this probably better than anyone because we understand the people closest to the pain should really help shape the policy. And we're not immune from these issues ourselves as legislators. Sometimes I think we're put at some type of exclusion. But I stand here as a Black man who's faced and has heart disease. 10 years ago, I went through open heart bypass surgery due to hereditary conditions that I didn't even know about until I had an annual physical and was told that I had to go to an emergency surgery. And so I share that because this is real. The issues that you all are talking about today are real. The solutions that we need to hear from you are real. And I want you to know that as members, we are serious about working with you. That's why it's important for us to be here today, to hear directly from constituents in spaces like this, where it's safe, where we can get the right information, where we can take best practices, and we can share that throughout all of our communities across the country, and yes, in fact, across the world. Now, I have, I guess, the distinct pleasure of introducing our esteemed moderator this morning. She is a change maker in the mental health arena, but this is her second act. She started her career in the music industry from intern to executive vice president, with positions at Capitol Records, LaFace Records, Columbia Records, Sony, Urban Music, and Universal Motown, where she worked directly with some of music's top talent like Outkast, Usher, Prince, TLC, Toni Braxton, and Erykah Badu. She is an accomplished entertainment industry veteran, speaker, author, and philanthropist. And with more than 25 years in the business, she pivoted to serving her community and established her own nonprofit, Silence the Shame Incorporated. Silence the Shame Incorporated was created to destigmatize and increase awareness around mental health issues in communities of color and other marginalized communities. The Silence the Shame movement encourages people to speak openly about their struggles with mental health, share their stories, and seek help without shame or fear of judgment. The Silence the Shame organization is a resource grounded in education and support, offering mental health workshops, counseling services, and community events to promote mental wellness and reduce the barriers that prevent people from seeking help. Silence the Shame has been leading the mental health movement since 2016, has received global awareness, and has become a commonly used hashtag to normalize the mental health conversation in America. With that, I'd like to present to some and introduce to others Ms. Shanti Das, and to thank her for joining us today and for your commitment along with the Congressional Black Caucus Foundation, our members, in your work to fighting for more equitable community health and awareness around mental health and so many other important issues. Thank you for having us. Thank you for being with us today.
Good morning, everyone. Can you hear me? Thank you so much, Representative Stephen Horsford, for that wonderful introduction. It truly is an honor and a privilege to be here this morning. And now I am delighted to introduce you to our panelists for this most important discussion and conversation. First, I would like to introduce Representative Terry A. Sewell. She is the chairwoman of the Congressional Black Caucus Foundation Board of Directors and represents Alabama's 7th Congressional District. Congresswoman Sewell sits on the House Ways and Means Committee and was selected by the Democratic Whip, Catherine M. Clark, to serve as a Chief Deputy Whip. And she also sits on the prestigious Steering Committee and Policy Committee, which sets the policy direction of the Democratic Caucus. Let's give a warm welcome for Representative Terry A. Sewell.
but not a friend.
Where's my,
And that's what we do in our community, right?
Absolutely.
That's each one teach one, each one help one.
Yay.
Hey,
hard to keep a Black woman.
that's right.
She said it's hard to keep a Black woman down.
Next up, we have Representative Robin Kelly, who represents the 2nd District of Illinois. Congresswoman Kelly is a member of the House Energy and Commerce Committee and serves on the Health, Communications, and Technology, Innovation, Data, and Commerce subcommittees. Congresswoman serves as the chair of the Congressional Black Caucus Health Brain Trust and also co-chairs the Congressional Caucus on Black Women and Girls. Let's give a big round of applause for Representative Kelly. Okay, ladies, we're going to dive right in. Okay, Representative Kelly, in 2022, you introduced the Health Equity and Accountability Act, a bill that broadly pushes for intentional efforts to reduce health disparities. Specifically, it requires more detailed reporting of demographic and health disparities data and increases access to culturally and linguistically appropriate health care. Can you share more about what has inspired your continued fight and advocacy for health equity reform?
Well, first of all, as I think I shared with you, when I went to college, I always thought I wanted to be a child psychiatrist. I was a psych major undergrad, and then I have a master's in counseling. I went on and earned a PhD in political science, but my psych and counseling actually helped me more in this job than the PhD in political science. But so I've always cared about people's well-being, whether it was mental or physical. And I think when I came to Congress, I never thought I was going to lead in healthcare because my husband's a doctor and I didn't want to hear his mouth every day telling me what to do. But when now HUD Secretary Marsha Fudge says you're going to be in charge, you're in charge, argue with her. So I've been doing it, I don't even know how many, maybe for like 8 years now. And I'm grateful for the opportunity because I've learned so much. I didn't realize, the disparities and the inequities until I became a member of Congress and just delved deeper and deeper, into various issues.
Absolutely. Now, how does this legislation specifically impact the Black American community?
Well, the legislation actually has been introduced every Congress since 2003, and bits and pieces of it have made it into various laws. And it is introduced by the Black Caucus, by the Hispanic Caucus, and the Asian Pacific Islander Caucus. We take turns because it cuts across race, gender, disability, language, ethnicity, sexual orientation. It cuts across all of those things in trying to bring healthcare to everyone. But as my colleague said, when you lift Black people in the health arena, you'll lift everyone. And I know the gentleman gave the quote about the difference in life. Well, there's a part of Chicago that if you go from the south to the north, there's a 30-year difference in lifespan, and gun violence is a part of that, also, which we see as a public health crisis.
Who and what are the opposing factors to this bill?
Well, money's always, always a problem, and the budget. And then the other thing is we're facing, as all of you know, we have a workforce issue to even put these different policies in place. We need more researchers, doctors, nurses, other people in the healthcare arena to be able to carry out, some of these policies. And then the other thing is, not to talk about my sister over here, but Illinois is very different than Alabama. States are very different. Like Illinois was the first state to expand Medicaid,
And we haven't yet.
Yeah. So, and that's a big difference when you think about maternal mortality and postpartum
Absolutely.
coverage, and so states are different, and they're even different in how they do research and collect data. And that's why we had such a problem with COVID, because states had different technical advances. Some states were more advanced. Some states collected data differently. So, those are the things, just dealing with the differences among local or states or even cities and things like that.
That's right. And that's why we're here today, right? So we can collectively come together to figure out how we can get more resources and bring these bills to life. Okay, so my next question is for you. The Biden administration has introduced more equity orders than we have seen in our nation's past. As recently as February 2023, the Biden administration introduced an executive order launching a White House steering committee on equity to raise the profile of racial discrimination and other issues of inequity. These efforts seek to advance equity in health, including mental and behavioral health and well-being, which I'm happy about, deliver an equitable response to the COVID-19 pandemic, deliver environmental justice, and implement the Justice 40 initiative. The administration has also established equity.
This meeting is being
across the
recorded.
federal government. How has this top-down approach impacted the movement for health equity in state and local arenas, in your opinion?
Well, let me also just say that both Stephen Horsford and Robin Kelly are members of the board of the Congressional Black Caucus Foundation as well, and they would deserve a round of applause for that. I'm sorry I didn't.
We can't tell her no either.
Let me also just say, when you think about health equity, you think about changing health outcomes. There is a serious problem with health disparities. And I think it's really important that we acknowledge that in order to get equity, you got to spend a little money. And it needs to be intentional in the communities that have those disparities. And so the Biden administration should be applauded for its efforts of really putting equity at the center of its administration, not just in health, trade, economics, you name it. He's really made each secretary, commit to equity and to moving that closer. Never did we see the effect of our disparities as much as we did during the pandemic, right? The pandemic put a laser focus on the health disparities that exist in this country. And we know those health disparities existed before COVID, but they really have impacted us in a way that is really, devastating. I think about my home district, Alabama. The median income for my district that I'm so honored to grow up in, have grown up in, and now represent, the median income for a family of four is $33,000. $33,000 in 2021 terms. Now, I know that what we lack in economic prosperity, we more than make up for in heart and spirit and in a strong work ethic, because we delivered the Voting Rights Act of '65, my district. So I'm not asking for pity. I know I come from great stock, if you will. What I am here to say, though, is that when you think about health equity, I think about leveling the playing field, giving communities that are vulnerable the resources they need to help themselves, and giving them the doctors and healthcare professionals they need so they can get the help to close that disparity and to change outcomes, because that's what it's all about, changing outcomes. And so my state didn't expand Medicaid. It's one of the 11 states that still have not expanded Medicaid. Actually, North Carolina just did. So 10 states now have not expanded Medicaid. And frankly, it has been a major problem. When you think about rural hospitals and the closures that we've seen, that over the last 10 years, 80% of the rural hospitals that have closed in states that did not expand Medicaid. That alone should make my governor want to expand Medicaid. But we know they call it Obamacare instead of the Affordable Care Act. And there are still lingering effects of the names and labels that we put on things. Nevertheless, we shall persist, because that's what we do. And thank God for our federally qualified health centers and our community health centers, who have really, the pandemic gave them unprecedented resources that they can now deploy. But we have to make sure that they have the staffing. I mean, they were really, the healthcare professionals, the real heroes and heroines of this pandemic. But they have to be given the resources to do their jobs. And until we as a nation decide to spend the kind of money we need on education and healthcare, we're always going to have disparities in economics. We're going to have disparities in outcomes, health outcomes. So the long and short of it is, I'm very, very proud of the Biden administration for claiming equity as one of its top priorities. But the proof is in the pudding. and it's all about the action. And so what I hope you gather from our conversation today is that all of us have a role to play. We are lawmakers. We have clinicians and doctors out here who treat the patients. We have health advocacy groups in this audience. We have lots of people who know someone with chronic diseases like obesity, like diabetes, like hypertension. And so I know that my district disproportionately has that in Alabama. So in fighting for resources, I'm fighting for equity. And equity can only happen if we hold accountable this administration's charge that they're going to use equity as its hallmark.
And the people that represent you in Congress and the Senate.
Yes.
They need to be held accountable to.
Yes, absolutely. Absolutely.
Thank you so much for that, Representative Sewell. I can certainly say as a mental health advocate and as someone that almost took their own life in 2015, health equity, especially in mental health, matters so much. And trying to find someone at that time from a culturally competent perspective, someone that looked like me, that understood me. I didn't have to explain myself every 5 minutes in the session. It matters. So thank you for that. Would you like to add anything to that, Representative Kelly?
I think Jerry covered it. One thing I'm going to say also about COVID that brought to the forefront maybe a little silver lining was the importance of telehealth and how we need to make sure that everyone has broadband. Even though I represent the Chicagoland area, my district is also urban, suburban, and rural. I have 2,000 farms in my district. One of my towns, my biggest town, actually, they only have one OBGYN to service the whole area. And yesterday, there was a man who rammed his car into the building of a provider because of the, anti-choice, pro-choice issue, and rammed his car, so they're dealing with life-threatening, things also. So, but I think telehealth really is so important. Right. And then
it's here to stay, which is great, which is why we need to get broadband in rural Alabama and in rural Illinois.
And then the importance of trusted messengers.
Yes.
I know they were navigators in COVID, but there's community trusted messengers that we need to take advantage of.
Absolutely. Got to have the access, folks. We need the internet. We need to be able to access these telehealth services. Thank you, Representative Kelly. Representative Sewell, I'd like to go back to you. Earlier this month, you introduced the John Lewis, my hometown of Georgia, John Lewis Equality and Medicare and Medicaid Treatment Act. What is unique about this legislation is that it requires the Centers for Medicaid and Medicare Innovation to work with experts to consider health disparities when developing payment models. Can you tell us a little bit more about value-based payment model and how will it impact disadvantaged and underserved communities?
Well, when we're talking about the payment scale and the payment method that Medicare and Medicaid, which by the way, the government is the biggest provider of healthcare insurance between Medicaid, Medicare, and TRICARE, we are. And what the John Robert Lewis Equity Act would do would be that to make sure that when you're considering these new innovative payment methods, that you take into account social determinants of health. I mean, what goes on in vulnerable communities may need more money than what goes on in more affluent communities. And so we need to make sure that we're taking that into account when we're coming up with these payment models. Look, I initially introduced this bill because, our valued, loved, beloved Congressman John Lewis died of pancreatic cancer. And when you look at the disparity in cancer alone, I'm just taking cancer, among white and blacks, it is staggering, right? That's why we need more clinical trials, to your point, where we participate in them. But we also need for the models themselves to acknowledge that. And so that's exactly what this bill will do. And, John will be known forever because of his bravery on a bridge in my hometown for voting rights. But John would also be very proud of us if we really, in his name, advance health equity. So that's what this is all about.
We certainly want to support that. Yes, please give it up. our final question this morning is for both of our representatives, and I'll start back with you, Representative Kelly. Too often we focus on how far we have left to go, right? And little on how far we've come. Could you all share some of the legislative wins of the last session that have advanced and propelled health equity for Black Americans?
Well, first of all, we accomplished so much in the 117th Congress, more than has been accomplished in a long time. And members that have been there a long time, not just about health, but just across the board, have said that. Members that have been there way longer than Terry and I, and they've agreed to that also. One thing I'm thrilled about, I have the Mamas Act. I've been working on maternal mortality for 7-8 years now. Again, did not even realize that what the issue was in the United States. And it was safer for me to have my children, and my son just turned 39 yesterday. But it was safer for me to have my kids than it is for my kids to have kids. That is absolutely ridiculous. But it was my push and my legislation that got the expansion of the postpartum care from 60 days to 1 year. And even though we haven't hit, 50 states yet, but my staff and I, who used to be a CBCF fellow, we are determined to champion this cause and see, the number grow from, like I said, Illinois was first, and now we're at 34, I believe. And there's other states looking at it. So very thrilled about that. And I'll mention one more thing, and that's the Bipartisan Safer Communities Act. We look at gun violence as a public health crisis, and Stephen Horsford championed that. And with there were about 5 of us with him. We call ourselves the new gun lobby, and that bill, we talk about background checks, and I did trafficking and straw purchasing, which also passed in legislation last year, because in Chicago, people always say, oh, you have the toughest gun laws, but that's because Indiana, Missouri, Iowa, Wisconsin, they've made it easier, to have a gun. But this piece of legislation actually invests in the root causes of the problem, actually invest in young people, actually invest in neighborhoods. It collects data, because if you don't have the data, you can't inform the policy or the programs, which informs the resources. Now, we passed that bill in the House, but could not get it passed in the Senate. But that doesn't mean we're not going to keep trying. And then the Inflation Reduction Act, which lowered senior costs, but that's the finance money woman, so I'll let her. She did like math.
Thank you, Representative Kelly. Representative
I'll start there. So the Inflation Reduction Act, I know it says Inflation Reduction Act, but when you have healthier people, you are saving money, okay? On the front end, not the back end. That's how I got in there. And also because it was a great vehicle moving. I sit on the House Ways and Means Committee with a subcommittee on health. And we were able, and health, as you know, on the Ways and Means Committee is all about Medicare. That's our jurisdiction, is Medicare. And so the fact that we now have a cap on insulin for our seniors of $35 is something to be proud of, and we are proud of that. And that came from our committee. Also, we capped the total annual cost of medicine for our seniors. We capped it to $2,000. That should be applauded. And these are all things that we could not get past before. And they were, even Javier Becerra carried one of those bills, the cap on the seniors. I mean, he's now the HHS secretary, but he's every year after year, Congress after Congress, he would file it. And so for me, I know what I hear the most about is lack of access and lack of professional, the workforce, the health workforce. And so one of the bills that I carry is the Graduate Medical Education Act, which this GME bill would actually increase the number of residency slots across the nation, and especially in urban communities, vulnerable communities, and rural vulnerable communities. And in the omnibus that we passed in the 117th Congress, we were able to get, now my bill asked for $15,000 over 5 years. That's what my bill asked, which costs money. But I'll take the 1,000 we got, I guess it was 2 Congresses ago, of residency slots. And this past omnibus, we got 200 more. So we're by piecemeal, really affecting access by making sure that we have more healthcare professionals and really making it easier for them to serve in communities that are vulnerable. You know, I have to say we have to start early because, you know, if you look at rural internal medicine providers, most of them grew up in those communities, right? So we got to start early, helping our children understand the importance of sciences and math, and really encouraging them to go into the medical profession. So that's one. The other one that we passed was the Maternal Vaccination Act, which was through the omnibus, and that would give mother and baby access to vaccinations at reduced cost. So that was a good bill to pass as well. Now, it was grant money too.
For like culturally, I don't like that term, culturally competent, but we passed legislation, so there's grant money for that. And I think today there's grant money that's being released around maternal mortality and morbidity issues. And also the other thing, data collection and research, there was legislation passed.
And I have to just give a shout out to my girl, Robin. You have championed that cause for such a long time. And I, you know, for the Ways and Means Committee, the oldest committee in Congress, to have a full committee hearing on Black maternal health, that's saying something. For 3 hours, we had experts. We had that Olympian, Allison, I can't remember her last name, who had a hard time conceiving. It cuts across socioeconomic background. So it doesn't matter if you have the money for access. Right. So that goes back to what you were saying, having doctors and healthcare professionals that have your lived experience, so that you don't have to necessarily add that layer, which is exhausting, to be honest with you. It's exhausting.
And we have to advocate for ourselves.
We do.
Yes.
Oftentimes, and that is exhausting, right?
I agree. But if we don't do it, who will?
That's right.
And
I'm sorry. We've heard stories from doctors that didn't tell the doctor they were a doctor, and how they could see the difference in treatment. I'd never forget one doctor said he had hurt his elbow from tennis. And when he went to the doctor, he didn't suggest the things that you would normally suggest. And then he said, well, what do you about this? Well, he did it enough times that the doctor said, oh, you know a little something about health. And then he said, yes, I'm a doctor. And then the treatment, you know, changed. And someone just told a story. He took his child and all the care, you know, you need this, you need that. That was great. But there was no nurturing of the parent, no consideration of they're scared to death because their child is suffering. It was just very to the point, cold, you know, like those kind of things that wouldn't happen.
But those kinds of bills really do get at the heart of what we've been talking about. And that is closing health disparities and trying to close that gap where they are. And there are lots of them. The bill that I am carrying this Congress, talk about filing bills, Congress after Congress after Congress. For the last 3 Congresses, I filed a bill that's the multi-cancer early detection bill. And this bill actually would allow Medicare patients to have access to leading, cutting technology. The technology that's out there now, with a vial of blood, you can actually screen for 40 to 50 cancers. That's a game changer. And it's really expensive. It's really expensive. It's available now through concierge doctors, which I don't know about you.
It's not for me. Is that for you?
Not on our salary. I'm just saying,
Okay.
You know, that kind of. But this bill will literally be a game changer. And so what it says is that once it has been FDA approved, because it's going through all the clinical trials now to get that FDA approval, I want to fast track it on Medicare. And we can do that. We know that once FDA approves a drug or a therapy, sometimes it takes up to 10 to 15 years to actually come to the patients. So fast tracking that would be really important. So I didn't introduce it this Congress. Last Congress, we had 258 House members, 250, it didn't pass, but we're close to it. 258 in House and 51 in the Senate. And I believe over the next 2 years, with the voices of so many of you who are in this audience and the voices of the members of Congress, that we will get it across the finish line, which I'm excited about. I didn't file it this year. My co-sponsor, Jody Arrington, who sits on House Ways and Means Committee with me, filed it. And when he came up to me on the floor at the beginning of this term and said he was going to file the multi-cancer early detection bill, I said, that's my bill. I know you're on it too, but like my office is working day and night on this bill, working with the stakeholders and stuff. And he said, yeah, but we're in charge now. The Republicans have the House now. And to give us the best opportunity to put that bill on the floor, I believe that I should introduce it. To which I said, I got to pray on that. And after 2 weeks of not having the ability to file it because we couldn't agree, I said, at the end of the day, this is really about getting a bill that will help so many of us. And so I don't care who gets the credit as long as we actually get it done. So he filed it. And when he filed it, after he filed it, dropped it in the hopper, he came over to me and he gave me a copy of it. It was named the Nancy Gardner Sewell Multi-Cancer Early Detection Bill. I lost my mom 2 years ago to pancreatic cancer. And I can tell you, I then thought, oh, hey, how sweet of him. But he's still a Republican who's against half all the stuff. But he looked at me and he said, it'll always be the Sewell bill, which is great. So anyway, we're going to encourage your members of Congress and your senators to sign on to it so we can pass it.
And I just wanted to throw in mind, I have the diversity in clinical trial bill. And so as you know that, we die from so many diseases, so we need to be a part of the clinical trial and we need everyone's help to encourage people. It's not like the old days, that you need to be a part of clinical trials, and we're trying to get it passed. It is, I don't know if that one's, I don't know if I'm as lucky as Terry, if that one's bipartisan, but we try to work in a bipartisan way on energy and commerce, and I'm on that health subcommittee. So we've been working really hard on that.
That's awesome. So we've accomplished a lot, right, ladies and gentlemen?
Yeah.
But there's still a lot of work to be done.
Oh, yeah.
For our aunties, our sisters, our nephews, our cousins, our dads, our nanas, big mamas, right? We have work to do for our families. So we should really make sure that we're doing all that we can as lawmakers and as basic humans, right? It's our human right to have access to healthcare, to be able to go to work and thrive and hashtag live our best lives, right? So this has been such an amazing conversation. I know I'm excited to join you in the fight. This is wonderful. Let's thank our CBC members for having this conversation. Let's give it up for Representative Sewell and Representative Kelly.
And let's give it up for our moderators. Awesome. You did it.
I would like to thank our congressional members for their participation today and all of the work that you all do to advance health equity. If you want to engage with us on social media, please tag @CBCF Inc. and include the hashtag Policy for the People. The next segment of the Policy for the People Health Equity Summit is a panel entitled Vital Signs, Culturally Competent Care and Opportunities for Trust Building in Pursuit of Health Equity. This panel will begin shortly after our break. Feel free to stretch your legs, grab some coffee and refreshments, and we'll resume in 10 minutes. Talk about what we just discussed, guys. We need you.
3 minutes.
Oh, 3 minutes. Sorry. Okay. Good morning, everyone. We are just about to start our next panel. Please make your way to your seats. We have some more exciting conversation and dialogue for you all. Thank you all for your attention. Please allow me to be the latest person to welcome you and thank you for participating, attending our Policy for the People Health Equity Summit. You all showing up is evidence that we care about our communities. We are pushing
for the policy that our members are doing on the Hill, but we're also working at the community level. So you being here is evidence towards that progress. My name is Desiree Solomon. I am the Manager of Research Analysis at the Congressional Black Caucus Foundation, and I'm so delighted to introduce our next segment of the event to you all today. Here we will be discussing culturally competent care and opportunities to advance health equity. Our last census evidenced the deepening demographic groups of our nation. And with a more diverse nation, we need care that is reflective of those needs. We need care that addresses and meets the individual person. Even amidst our own communities, we have folks that are from North Africa, East Africa, South Africa, Central Africa, historical African Americans, if you will, speaking many different languages. And so they deserve that same quality of care, that model quality of care and affordable care as every other American. So that's exactly what we're here to talk about today. So I'll begin by introducing our moderator, Dr. Trelonda Triplett. Dr. Triplett is the Director of Public Health at the Center for Policing Equity. Dr. Triplett leads Center for Policing Equity's efforts to promote and comprehensive wellness by integrating population health promotion and health equity into CPE's mission for policy and public safety reform and social justice. Heal the people, heal the world. That's her signature approach. Dr. Triplett completed her undergraduate degrees in business, I said degrees, okay? So she completed her undergraduate degrees in business administration from Clark Atlanta University and industrial and systems engineering from Georgia Tech, and is a distinguished alumna of the University of Miami, Leonard M. Miller School of Medicine, where she earned her Master's of Public Health and Doctorate of Epidemiology with a specialty in public health ethics. Her systemic insights blends scientific foundations with community-centered and data-driven approaches to innovate and sustain essential changes to address social inequities and disparities in health status and outcomes. Please welcome Dr. Trelonda Triplett.
Goodness gracious, sometimes I turn around and see who she's talking about. I am so thankful and honored to be with you all today on such a momentous occasion. I am only eclipsed by sharing the platform with these. I'm just gonna start talking. There's no need to even go into the just incredible platform that I'm sharing today. So I'm just gonna go right into it. Is that okay? Fantastic, okay. It is not by happenstance that our platform today is entitled Vital Signs. We actually have an opportunity today to discuss several key topics that are indicative of the health status of communities and the mechanisms to impact disparities that populations endure. So, without further ado, let me introduce my platinum mates, my platinum platform mates today. Okay, you see how I got through that? That's how I do things, okay? All right, I have to my immediate right, Miss Shalina Ramnarine. I told y'all. She is the Director of Our Race to Health Equity Community Engagement. Shalina manages a social impact community portfolio consisting of partnerships with nonprofit, academic, and other organizations doing work in communities aligned with Johnson & Johnson's commitment to support the elimination of racial health inequities. Next, we have Rear Admiral Dr. Felicia Collins. My goodness. Okay. She is the Deputy Assistant Secretary for Minority Health. As the Director of the Office of Minority Health, she leads the office in its mission to improve the health of racial and ethnic minority populations through the development of health policies and programs that help eliminate health disparities. She brings more than 20 years of federal service to this position and a passion for serving vulnerable and underserved communities. Finally, to my right, we have Mr. Michael Greer. Michael J. E. Greer is Director of the Federal Affairs for the National Committee for Quality Assurance. He oversees legislative and regulatory issues impacting healthcare quality. Michael has experience working on federal, state, and local levels of public health and health policy, having worked in an array of areas. And finally, we have an additional member that is joining us virtually. All right? We're going big now. We're going big. Okay? We have Dr. Garfield Clooney. He currently serves as president of the nation's oldest and largest organization of African American physicians, the National Medical Association. He has been dedicated to his beloved NMA since medical school and has served on the board for more than 15 years. Dr. Clooney has built his career on serving vulnerable populations and as an advocate for the elimination of health disparities and seeking health equity for all. Dr. Clooney is double boarded as an obstetrician and gynecologist, an MFM, and is an associate professor of OB-GYN at NYU's Grossman School of Medicine. Ladies and gentlemen, did I say platinum platform? I meant platinum platform. So join me in welcoming the Vital Signs platform. All right, so let's get right into it. You know, we are here because this is a serious situation. You heard the Congress members talk about, they're serious. This situation is serious. We are in a situation right now where people have a tendency to say words they don't know what they mean. Am I right about it? Let's start with cultural competence. Let's go to that. Okay, so let's start. Can you give me a definition of cultural competence? Dr. Clooney, can you hear me? Let's start right there. Can you give me a definition of cultural competency? And I know everybody in here has a hard and fast rule and definition of cultural competency, but for, just me, I guess, we'll start with a definition of cultural competency. Y'all get ready. That's right.
And let me just say hello to everyone, and I apologize I could not be there in person, but I had a little emergency in my office and I had to stay back, but thanks to CBCF for inviting me as well as accommodating me virtually. I really appreciate it. So when you talk about cultural competent care, you're really talking about providing care for patients with different beliefs, different values, and you have to tailor their medical care to their beliefs and their values, to their language, to their culture. And so I think in the medical field, we're used to having a sort of fraternal, if you will, stance with patients. But now we're realizing with the United States, as our previous person who did the introduction stated how diverse the United States is, we have to take into account that there are individuals here that have different beliefs and different cultures, and in order to get them to buy into their care, for lack of a better term, or trust you in terms of their medical care, you also have to cater to their needs as well, culturally, and their beliefs.
Absolutely.
At my institution, I take care of a diverse group of people. Sorry, I'm getting a lot of feedback.
No, go right ahead.
It sounds okay then?
Yes.
Yeah, I take care of a lot of patients with a diverse population, and I'll say, like, to tell you an example, I had a religious Jewish woman come in for a consultation, for high-risk pregnancy consultation, and she came in by herself, and as usual, I walked her into my office, I closed the door, and she said to me, "Can you please open the door?" And it was strange to me because in terms of a privacy issue for patients and their medical care, but according to her culture and her beliefs, a woman cannot be in a room with a man alone. And so, that's a very important, very small thing to accommodate someone with, but extremely, extremely important. Absolutely. And so as we go along with medical care, we have to take in these cultural competency elements into our care.
Absolutely. And Dr. Collins, what would you say if I asked you what a definition of cultural competency might be? What would be some of the things that you've seen in your experience as a definition?
Well, within the Office of Minority Health, we talk about culturally and linguistically appropriate services. So that's the broader umbrella in which we use it, which cultural competency is definitely a part of that. And I'm actually fond of something that the North Carolina Office of Institutional Equity and Diversity says, and they describe cultural competency as a circular process involving 4 elements: awareness, attitudes, knowledge, and skills. And so first you have to be aware of your own worldview. So there's your awareness. For attitudes, you want to develop positive attitudes towards cultural differences. For knowledge, it's important to gain knowledge on different cultural perspectives and worldviews, and then developing skills for communication and interaction. And ultimately, that's what you're doing. You are doing all of this so that you can have effective communication and interaction with diverse populations.
Absolutely, I would agree wholeheartedly. I think that circular interaction is what is key, because it's not a one-way. It's a dialogue, whether, it's from the front door to the back. It's, when you come into a situation, whether it's public health or health care, it's an interaction, it's a relationship that we are initiating or sustaining. And I think you brought up some very key points. You want to add something to that?
Yeah, I would just also say that cultural competency, to Congresswoman Kelly's point, can be a little bit of a misnomer. You don't just learn a culture and then it remains static. And so going to Dr. Collins' point, it takes awareness. It takes a constant learning. That circular dialogue isn't just about communication. It's also the learning cycle that we have to go through. Just because you're a Black physician does not mean you understand every Black person. You may not understand someone who comes from a Caribbean culture. You may not understand someone who comes from an East African culture versus a West African culture. And so we have to make sure that we're thinking of that, not just in the context of, I took that cultural competency class and I know how to talk to Black people, but we approach it with a sense of humility, and we say, hey, I've done this work thus far, but I'm ready to go further. And I have this willingness, this openness to continue learning and progressing in my knowledge of culture and my understanding of culture and practicing those class standards.
Yeah, I agree. That's the story I was going to share. So originally I'm from Trinidad and Tobago, and I grew up with my Indian family. So I remember coming to America and people saying, oh, you're Black, you're going to get diabetes, you're going to get hypertension. And I was so confused because I'm like, well, I'm Black and Indian. Like, does that apply to me too? So that's actually what led me to get my PhD in human and statistical genetics. I wanted to understand differences in terms of genetics and disease susceptibility. So, a couple years back, they used to call it precision medicine. That was all the rage. We want to make sure people are getting medicine based on their genetics, because it's debatable whether or not race is biological or not, but it's not debatable that our lived experience impacts care. And so that's why I think it's great that we're having this conversation and we're taking it one step further beyond saying you need medication that's appropriate to you, like even diversity in clinical trials. Not all Black people have the same genetic markers at all the locations, right? So you can't just say, I'm gonna go to rural Alabama and I'm gonna get something that's gonna be applicable to all Black people across the country. Genetics doesn't work like that. We need diversity. We need to understand the differences between a Black Caribbean person, an African Caribbean person that's in the US. And I think this layer of cultural competency says, how might my lived experience impact the way that you're speaking to me, the way that I understand information, how much I trust you? I tell doctors all the time when I go to the doctor, I have a PhD. And why do I say that to a doctor? Because I want them to see me. I want them to explain things to me. I want them to make sure that they are following up on my care, and I'll tell them, oh, my friend's a doctor, I'm gonna follow up with them about this, right? Because I want them to be on their toes. And that's so unfortunate that I feel like as Black people, we have to make sure doctors are on their toes and they're giving us the best care. But to me, that's what cultural competency is all about. Understanding, how do you speak to somebody on their level? How do you make sure that you're treating them with dignity and respect so that they feel comfortable and like they're getting their appropriate care?
That's exactly right, and that is an ethical question. That that brings me to my next question, because I think it is as important as you all heard. I've studied just about everything on the planet. So it is as important to understand what cultural competency is not than it is to understand what it is. So our next discussion, and we've already kind of talked about it a bit, is understanding contrast between race, ethnicity, and culture. You see, and it's similar to what we've already discussed, to understand that race is a social construct. You know, what you believe about the four of us sitting up here is on you. The fact that this young woman right here is of Trini descent, you never would have known unless she told you, plain and simple. The fact that my family is from Russell County, Alabama, we just lost the congressperson. You never would have known unless I told you. And so how does that influence the quality of care, let alone the access to care? That's a different discussion altogether. So again, when we are talking about health equity and the road and journey towards it, number one, it is a spectrum. It is a process. Y'all know I'm an engineer. It's a process towards getting there. And Dr. Clooney can certainly nod to the fact that, you know, who you are before you get to the doctor's office is going to impact and influence what happens to you once you get there. Okay, so if we could get past that, so let me get to another term that we hear an awful lot, and that is trauma-informed care. If I hear that one more time, I'm gonna jump out a window that's not even in here. Okay, Dr. Clooney, are you with us?
I'm right here.
All right, trauma-informed care. Are we ready to define that? Just for this room right here, I know everybody in here understands what trauma-informed care means. Dr. Clooney, start us out though. What is a definition of trauma-informed care that we'd like to roll with today?
So you can really, I think you can really look at it as looking at the entire patient when you are going to care for them. And what I mean by that is, we say often in the medical field that patients are non-compliant. And what we have to do, we have to dissect that and unpack that, as we say these days, because I believe that patients want to take the best care they can of themselves, but there are obstacles in the way, and there are obstacles in your past that may affect how you seek out healthcare. So I would say trauma-informed care is really delving into the entire patient, their life story, and helping them through their challenges of understanding what it takes to manage their care. And I'll give you an example that I'm dealing with right now myself. I have a friend, a good friend of mine, who has curable prostate cancer. Curable prostate cancer. However, his physician told him the word cancer, and all he could think about is his sister's journey through having cancer. And all he can say, I'm a physician, I'm a friend, and I'm trying to counsel him on how curable it is for him. But all he can say is, I'm not going through that any cancer treatment because it destroyed my sister. I'm not doing it. And, I'm trying to get him to understand that all cancers are not the same and all journeys are not the same. And so that trauma that he is suffering from, we have to help him overcome so he can help himself. And so trauma-informed care is looking at the whole patient.
Absolutely. Now, Michael, you do a tremendous amount of work in looking at quality of care. I know you do. And when you start to introduce concepts like trauma-informed care and looking at quality of care and intersecting, I'm being very, very nice, issues like trauma-informed care. And we just heard Dr. Clooney talking about how, there is not a person on the planet that is immune from trauma-informed care or trauma. Where do you live without trauma? I'll ask one of you all. So how do you integrate then the concept of trauma-informed care into what it is that you do on a daily basis? And you get ready, because I'm coming, okay?
That can be a bit of a challenge. So I'll talk a little bit from the perspective of NCQA. NCQA accredits health plans. And so what that means is they receive quality measures on physicians and the types of care that you receive. And based upon that, that impacts payments that physicians received and medical organizations receive. And so when you're talking about the integration of trauma-informed care and making sure that that patient perspective is there, the way we're measuring the outcomes, the way we're thinking about how the care is provided, we have to change what we're measuring. And so when we're looking at something like health plan accreditation or accreditation for a healthcare facility, we really need to be thinking not just in terms of those clinical quality measures, which is, okay, you had an abnormal pap smear. Within 1 week, did you receive a follow-up visit? Did you receive a follow-up screening? In 30 days, did you receive this? But we also need to think in terms of patient-centered outcomes and how we are developing, you with your clinician, developing outcomes that allow you to move forward and progress and move past that trauma, particularly when you're talking about the integration of your behavioral health as well as your mental health, behavioral health as well as your physical health. And so that is one way that we can really work to integrate and include and improve healthcare in a setting through patient-centered outcomes, combining those with your clinical outcomes, and really thinking holistically and holding health plans accountable for those quality measures and reaching the goals that you as a patient set with your clinician, as well as those things that organizations like NCQA come up and through research and analysis say, this is what it means to have high quality care. So that whether you're a physician or you're experiencing homelessness, you receive the same quality of care, and that reimbursement is the same and better when they provide you higher quality health care. And so that's how you can integrate that trauma-informed care, make sure that we're moving together and we're moving our entire system to improving healthcare and improving the patient experience overall.
Absolutely, absolutely. Dr. Collins, when you look at the agenda for the Office on Minority Health, my goodness, I can only imagine what that looks like. I know your strategic plan is probably, it can fill this room, and so when you introduce and you start, it's not like it's new news to you and what happens to minority populations or marginalized populations in this country. But when you introduce and put a name on something like that, like trauma-informed care, how does it change your approach, or how does it change the agenda items that become strategy for this country? How does it?
So within the Office of Minority Health, issues related to trauma-informed care are part of our broader culturally and linguistically appropriate standards. And so we have national standards that we promote, 15 action steps for individuals and organizations to support culturally and linguistically appropriate care. And so the connection in our minds between cultural competency and trauma-informed care is that culture, we have to remember that culture and our cultural experiences of trauma impact our vulnerability to trauma, how we perceive trauma, and our response to treatment. And so again, you can apply that same overlay of knowledge or awareness, attitudes, knowledge and skills, that cultural competency, circular process applied to trauma in order to best serve patients and our communities in general.
Absolutely. And I did not forget about you. I did not forget about you. I think that when we look at your race to health equity, we certainly have to consider everything from a systemic perspective. It certainly is not a one-hit wonder. We certainly are not solo acts.
Yes.
And certainly when we start to look at community-based approaches to addressing health disparities and going towards health equity, certainly trauma-informed care as well as cultural competency are hand in hand in this process.
You read my mind.
Oh my goodness.
So,
I told you we've been passing each other all day. So
So
How do you
Race to Health
integrate all of
Equity
that?
is Johnson & Johnson's $100 million commitment to health equity over 5 years. And so I'm incredibly fortunate to be able to oversee half of that portfolio. And so I spend my time with community members all the time. Everything from academic institutions to people on the grassroots making hip hop videos about stroke to be able to educate people in their family. And so it's beautiful to be able to see the broad approaches that people are taking towards health equity. And so when I came into this role, I learned about community health workers. I don't know if you guys have ever heard about community health workers.
Yes.
I have to admit, I was so unknowledgeable about community health workers, and now I'm such a fan of them. Because you go and you meet these people. We were in Columbia University in New York, and they were retired older women who wanted to educate their community about diabetes. We did some work in New Mexico where you see community health workers that literally have medical supplies in their car and are driving around to homeless people to help them. They work in a variety of different settings. Johnson & Johnson's had a long-term commitment to community health workers, but I'm convinced that they're critical for health equity. Because at the end of the day, I love that we're having this conversation because so much of health inequities gets reduced to an access problem. But when you go to the doctor, what happens? Okay, we can get you to the doctor, which is incredibly important. But when you get to the doctor, who listens to you? We know that physicians are incredibly overwhelmed. They're seeing so many patients. They have so many demands on them. They may not have the time to truly sit and listen with you. But a community health worker, they can. I heard the story of a community health worker that was helping a woman who tried to get her diabetes under control. And she was actually in an abusive relationship. And so that's why she couldn't get her diabetes under control, because she was just trying to survive and deal with the stress. And in my own life, my family was visiting from Trinidad and Tobago, and we took them to community health center. And the doctor had time and sat and talked to them about diabetes, hypertension, cholesterol. And they said in their lives, they've never had someone spend that much time with them and explain things to them in the way. And so now they understand, oh, that's why I got to check my sugar, not just once a month. You know, they just never had those kind of conversations. So I'm a big believer, and that's why Johnson & Johnson has supported community health workers because of the work they do, but also community health centers. We need more of that face-to-face interaction, because you can't talk about trauma without the personalness of it. Trauma is not like a large systemic thing. It can be, it impacts us in that way, but it's very personal. And dismantling trauma takes real trust and relationship, which takes time.
That's absolutely right. Absolutely right. Okay, there's one other thing that I really, because we could do this all day. You already know that. You already know that. Social determinants of health. That field is growing. And I want to introduce, if I introduce nothing else today, we have talked about health access. We've talked about housing. You've heard all of those different things, and economics and voting and all of those things that influence the health outcomes of communities. Here's one I want to introduce to you. You ready? Public safety. It's a social determinant of health. You heard it right here from Dr. Trelonda Triplett. Okay? Now, why? Because if I see a police officer pull up behind me and the lights are flashing, my heart starts beating. Something is wrong, ladies and gentlemen. And the work that I do at the Center for Policing Equity is to address that systemic issue that is connected to public health. Public safety and public health are indelibly linked. And I bet if I ask Dr. Clooney, he's going to say, you're absolutely right. If I ask any one of them, wouldn't you be nodding? These are systemically linked. This is not an individual situation. This is what this panel is here to share with you. These are systemically linked. That's why we're here today. This is the approaches that we are taking here are systemic in their nature. We're not all sitting here. We're going to hold hands before this is over with, because we are stronger together. Okay? Now, while we are here together today, there will be a health fair. Please take advantage of this information. Take advantage of the excellence that is in this room today. Okay? Now, we got about 5 minutes to go. We're gonna start with Dr. Clooney. We're gonna give you 2 seconds. 2 seconds. We're gonna leave.
Say what?
We're gonna leave you. We've got a room full of excellence in here. We're gonna let you leave them with one takeaway message. Okay? And then,
Wow.
and this is NMA's message. You ready?
Wow, one takeaway message.
That's right. That's right. I told you, stay ready.
What can that be? I think that the conversation that we're having today, especially around cultural competency and the diversity of the United States, is a really important one.
Yes.
You know, the National Medical Association, our mission, revolves around preventative care, health and wellness, physician viability, and all of these things that we talk about revolve around those missions. If I had to say one thing to the group, wow, you really got me on this one. I would say,
You want me to come back to you?
let me, one thing, wow. Yeah,
See?
come back.
He's a doctor, he can't help it. Okay, guys, okay. I knew you would. I knew you would, Dr. Collins. There you go, I knew you would.
So, and it's not really one thing though.
I knew that.
It's not really one
That
thing,
too.
right? Because it's too complicated, right?
Yes, it is.
We need diversity of workforce, we need cultural competency, we need access to high quality healthcare. And so what I would leave with you all is that whatever realm of health equity and health disparity speaks to you, get understanding, get knowledge, and then get to work and
That's
do
right.
something about it.
That's
We have to address all of these areas, and each and every one of you have something that you can do. If you're a writer, then write about it. If you're a legislator, then make legislation about it. If you're a data person, collect the data, publish the data. If you're a painter, paint, tell the story, help to visually represent what the story is. But whatever, get your knowledge, get your information, and then get to work with us.
I agree wholeheartedly. Any other comments? I knew she would. Let's go.
I think the one thing I'll leave everyone with is the concept of centering. I'm not sure if people are familiar with that term, but it's a term I think about a lot in terms of like, who are you really trying to focus on? Who's at the center of what you're trying to solve? Who's at the center of the conversation? And so even though I work for a large pharmaceutical healthcare company, which is incredible, every time we interact with a community group, I think about who are we centering in the conversation? How am I enabling who's at the center of this to have better care, to be more empowered, to show up in a different way, to get all the support and everything that they need? Because I think with the conversation of health equity, it's very easy to not center on who it's actually about. And at the end of the day, this is a heart thing. It's about the people every day that just want to live a good life, want to be with their families, want to have fun with their friends. And so I think if we bring in more of the concept of centering and making sure we're really focusing on the people that this is all about, at the end of the day, the world would be a better place.
I agree. Comments?
I would leave today by saying, if it matters, measure it.
That's heavy.
We know that health disparities are all throughout our healthcare system and all across this country. COVID revealed a lot, and it revealed that we were not measuring where it mattered. And so there are so many inequities, and we lost so many lives that could have been saved if we had been measuring and counting and looking where we needed to look for a long period of time. For so long, we've given billions of dollars to our to health plans, which they do great work. And I support health plans. I want to be clear there. I support health plans. But I think that we can do more in making sure that those resources are focused on the communities that need them most. And we do that through accrediting those health plans. If a health plan has a NCQA if they undergo health plan accreditation, all of their race data is stratified across the categories that OMB has available. We are looking at that. We're moving into the digital space and making sure that that information is now interoperable and being shared back and forth between not just the health plan, but providers all across the country that need it and can access it when they need it. And so if it matters, measure it. And we need to make sure we're doing better measurement, and we can do that through stratification of data and really pushing our health plans to do more because they are so integral in the health of all of us today.
All right. All right. Dr. Clooney, one more chance.
I'm here. Yes, I'm here. If I
All
had
right.
one thing to say to everyone, it is vote. And I'll tell you
Absolutely.
why I say that. I'll tell you why I say
Absolutely.
that. We talk about the social determinants of health and how they affect everyone's health every day. And also, when the Genome Project was released, they told us we're all 99.9% the same. But
right.
that 0.1% difference may have to do with the environment we live in terms of our health outcomes. And so if you want resources to go to things that you care about and that matter to you, you got to get out there and vote.
Absolutely. Absolutely. Thank you so much. Now, my closing note will be simply this. We can all agree with the World Health Organization that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease, which means each of us has an essential role in managing it and coordinating it for ourselves and for each other. Promoting and sustaining health and equity is not something that begins or ends in our physician's office. Cultural equity and competency and trauma-informed care means we see to it that our perspectives remain broader than our individual needs. We need to look at communities in and around the corner and around the globe. How would you recommend immediate action steps for community members to improve health equity in their communities? Start with you. The time is now. Thank you so much. Thank you, thank you, thank you. Have a wonderful rest of the summit. Be well. Stay in touch. All right. Well done.
The recording has stopped.
Welcome back, everyone. Thank you so much for participating in our breakout sessions, getting some targeted information on these topics that are impacting our communities. My name is Desiree Solomon. I'm the Manager of Research Analysis at the Congressional Black Caucus Foundation, and I am going to welcome up our 4 volunteers who are going to give a readout of what was discussed during these breakout sessions. They're going to share 3 action steps that as communities we can take to address chronic stress, cancer care, kidney disease, and heart disease. So please, if you volunteered to present those 3 action items, please join me on stage. And let's give them a round of applause as they make their way. Thank you so much for volunteering. Okay, we should have one more volunteer. Okay. Okay, wonderful. All right, so we'll have our breakout session representatives share their name, what session they participated in, and then the 3 action steps for community members to take to address this issue. All right.
Good afternoon. My name is Carlita McElwain, and I work for Susan G. Komen, and I was part of the cancer breakout. Oh, do it all now. Sorry, you would think I do this every day, but I don't. I'm on the research side in the back. Anyhow, we had a breakout session that was both about breast cancer and prostate cancer. And for some of you who don't know, and some of us that were in the session did not know the correlation between having the BRCA gene and prostate cancer. So that also meant that we were also looking at some of the disparities and how to bridge that. We looked at some of the things such as what Komen is doing, excuse me, which is partnering with participants and patients who have breast cancer to assist us in our research, to ensure that they know that they have a voice beyond being a victim. They are not victims, they're advocates for themselves and others. We also looked at the necessity for clinical trials, research development, also understanding the different types of breast cancer and how it also affects men and women, and men are stigmatized for having breast cancer. We need to have a voice in the community, not only just in academia, but also in our HBCUs, also in our community health centers, and in some cases, some of the ancillary services such as Patient First. That might be the first and only place people go to, and making sure that we continue, regardless of some of the messaging that is out there, to note that we need policies about breast cancer research, and the Congresswoman talked about it today, and we also need to make sure that we're continuing to advocate for women and men to get breast cancer exams.
Good afternoon, everyone. My name is Ignacio Alvarez. I'm from the National Kidney Foundation. I went to the kidney failure workshop, and our 3 takeaways were: firstly, get screened. Make sure that your albuminuria, your urine cultures, your urine samples, as well as your EGFR is monitored, especially if you are within the high-risk population, those that have hypertension and diabetes. There's no better way to fight against kidney disease than to detecting it early and delaying its progression, because it is treatable. It is diagnosable, excuse me, and it is treatable. Secondly, educate ourselves. In the session, Stephen made a very impactful comment to bring it back to your families. It's not just academic education, having what is the scientific evidence at the ready is vital. It is equally vital to bring that education home amongst your family members, your friends, your communities. I come from San Juan, Puerto Rico, and I can tell you that's one of the most debilitating realities we have back home. Puerto Rico is not what it was 20 years ago, and it is because we have not educated ourselves at a family level, personal level, and that is one way to bridge, the gaps that we all see on a day-to-day in healthcare, in kidney health specifically, and stay hopeful. Excuse me, I almost missed the most important aspect of that second priority is bring back that education home, bring hope back to your homes and to your communities. Lastly, advocate. My colleague here was more than kind enough to remind us that we're here advocating for the patients, and that patient might be a family member, that patient might be a friend. At the end of the day, they do not need to be only that. They are our neighbor. They are our fellow person. So advocate in terms of kidney health for medication access and healthcare access. And we're here for equity, so.
Hi, my name is Samhal, and I was with the heart disease group to hear about the presentation, excellent presentation by Dr. Swain. Please give it up for him again. We talked about really looking at the disparities across peripheral heart disease, peripheral arterial disease in marginalized population. And I think what the presentation has given us is the staggering difference between peripheral arterial disease and the treatment options that are presented, and also the health outcomes difference. And it's not just a small amount, it's really a staggering amount. And this is by actually excluding, we talk about like access to care, right? Even these populations that they looked at in their studies actually seemingly had some sort of access to care. And so we talked about like what other social determinants are actually going into factoring in this bigger differences that we see across the board. And to summarize, I think what I kind of like hear from the other groups is, even though we were in the different subgroup sessions, I think the message was resonating across, and we did definitely talked about and highlighted the social determinants are rooted in the similar and root causes is of like institutional racism and also systemic advocacy, right? Like across the board, starting with our own family, with our own community, and going across to legislators as well, which are also in the same room, and advocating for people to not only get access, but also just to know about what their options are, and asking for a second opinion is something that resonated with me a lot. And obviously education, community education is the biggest tool that we have at our disposal. And we talked about like not only just accepting one option that's been presented, be it our care provider or at a community health engagement, but ask for more. I think that's one thing that kind of like send a message across was this. It is okay to ask questions, and to be able to do that, we should definitely educate ourselves and equip ourselves with the knowledge to advocate. Thank you. I think that was I hope I did your presentation.
Hi, everyone. My name is Fiona Mesfin. I'm representing Unity Healthcare. We are local. And I was in the chronic stress breakout session, and we discussed how it's a common denominator for many of the diseases we discussed today, and just the ever widening health equity gap. So the key takeaways from today's discussion, we want to make sure we're advocating for the utilization of the average childhood experience scores more directly in general healthcare. And also discuss the social determinants that contribute to chronic stress. And the treatments that help alleviate stress include sleep, physical activity, mindfulness, nutrition, healthy relationships, and talk therapy, which also happen to be the 6 highest grossing industries in the US. And last but not least, we highlighted the importance of addressing chronic stress as a sorry, as a common denominator, and making sure that we are learning how to manage our own stress as the first step to make a change and having those hard conversations.
Thank you. All right, thank you to our volunteers. We really appreciate your participation. Please feel welcome to take your seats. So these were really packed breakout sessions, as you can tell. And these volunteers did an excellent job at covering some of those key points and items that we can take back to our communities and share. Now I'd like to welcome the Congressional Black Caucus Foundation's President and CEO, Nicole Austin Hillary, for our concluding remarks. Thank you.
I am so impressed with those volunteers. Thank you all again. Everybody is not comfortable standing up in front of an audience talking, but they did it, did they not? So thank you again. I am so elated and excited, as I was this morning, but I'm even more excited. I had to leave for a little bit today, but I was checking in with folks on my team and seeing, tweets and all these things. And as soon as I came back in, people were like, this was great. This was awesome. This is what we did. This is what we're going to do next. That is exactly what we hope for. I tell people all the time, I am no longer hosting, nor am I attending a conference, a summit, or convening where all you do is look at people who are dressed really pretty and talk a lot, and then everybody goes home. That is not about the business. We have work to do. And you all exemplified that today with the critical discussions that happen, the strategic planning, and focusing on really how do we get to the core of so many of these issues that are happening in and around our communities. That's what a summit is. I mean, you all do look pretty and nice. Let me not make that mistake. But you're here so that we can get work done. You're here so that we can make a difference and have an impact. That's why we do what we do here at the Congressional Black Caucus Foundation, so that we can have an impact on the future Black leaders that are produced in this country, on the future fellows and academics and scholars, on the legislation that's going to be passed and introduced, not only in Congress, but in and around the country, in our state houses, in our local jurisdictions, in our courts. And we're here because we want to educate the public and we want to arm people. We want to arm people with information. Remember when I started today, I said knowledge is power. We're coming full circle. That is how you arm communities. So now with the vendors who were here today and the time people spent with them, people have more information. With the time you all spent in these workshops, in these breakouts, and I know you all, I'm going to date myself, exchange business cards, or what did you do? Pulled out your QR codes, but I know you all made connections and you all will follow up. And that is called connecting the dots. And that's what this is about. That's what we do. That's why the CBCF exists. When the founders of this organization got together, those few leading Black members of Congress who were really the trailblazers, when they said we wanted to create this foundation, what they said is, we want a foundation that is going to create the next generation of Black leaders, and we want it to be a think tank. We want it to be a place, a resource where Black America can come and say, whatever the problems are, how do we solve them together? You give us the research, you give us the data, you help us to educate the public. That's why we exist. So I am always elated when we can bring smart, talented, dedicated folks together like you all in this room. And thank you to all of the people who are joining us virtually. You all, let me tell you, we had a good problem that we faced. We had a count, we have an amazing strategic events department, and they had a count, but you all exceeded it. And then we had tons of folks who said, well, we want to be online. That is a good problem to have. I am just buoyed when I see that there are so many people who are saying, we raise our hand, we want to be in the room, we want to be problem solvers, because that's what this is about. This is about problem solvers getting together. So thank you all for those who joined us online, but a special thank you to those who are here in the room with us, especially you all who are here at this time of the day. I know you all are super smart, busy people. Lots of people are calling on you to do things. You have lots of priorities and obligations because you are change makers, not only in this room, but in the other rooms where you sit. And the fact that you are still here with us going on 3 o'clock this afternoon, I can't tell you how grateful we are to you for that. That also shows your commitment. And it also shows more than anything, how important you all think these issues are and how much you value us all working together to create change and to make a difference. So thank you all so, so much. I want to just remind us all what we did here today. We got into some tough discussions. As I was listening to the sister here talk about cancer, I of course have dealt with that in my family. So many of us have. These are serious issues. And when we talk about mental health, because even when you talk about the stigma attached to men having breast cancer, that is about mental health. All of these things are interconnected. So we did some tough work here today. And the work is not over. So I want you all, as I said, no longer am I going to have my name associated with conferences and summits where we don't have next steps and don't do anything. You already heard from our volunteers. Those are the readouts. Those are the next steps. My colleagues Desiree and her team and Jumi and Solomon, the folks who are in our research division, they are taking everything that you all talked about today, and we're going to put this into action. And we expect you to do the same thing. So that means I want you to come back to our website. I want you to look and see what we're talking about. I want you to look and see what research our fellows are producing. And I want you to also look and see what else can you do with us? Because the Policy Summit, and this is our first in-person health equity summit. So yeah, that's a big deal. But we will have more. We will have more opportunities. And of course, so many of you know that we host the largest Black public policy conference in the country, our annual legislative conference. And that's what it is. Again, I know you all look pretty and everybody's in town for that, but it is the nation's largest Black public policy conference where we have experts from all around the country. We have international experts where folks are coming together to solve problems. So we're going to continue to work on problem solving around this. I no longer want to hear stories. I can't wait to get to the day. Sometimes people say to me, what would you do if you could no longer work on civil rights, social justice, and race? And I said, trust me, I will find something else to work on because I would love it if we lived in a nation where these problems no longer existed. Please, I will find something else to do. I will find something else to do. So we have work to do and it has to continue. So we implore you and invite you to join us at our annual legislative conference where the work will continue. And again, we will be having other events, other times where we will be talking about these issues. We're going to be partnering with other stakeholder organizations who do this work. And really, I will tell you, my team hears me say this all the time. We are an army of warriors. You all are a part of that army with us. We are standing arm in arm together to work on these issues and to make a difference and to really show people what this country says it stands for. You know, when this country was founded, regardless of all the history and all the issues, that's another summit that we could talk about. This country was founded on a set of principles and we were all promised equal justice, liberty for all, access. So it is our job to make sure that our country gives us our due, exactly what it promised to us. And that is a part of what we are all working to do. So thank you all for being here and thank you for continuing to do this work. I cannot let the day go by without ending where we started, which is thanking the people who have made today possible. I want to again thank our title sponsor, Johnson & Johnson, for all of the work and the support that they've given to us. And I want to thank all of our organizers, our speakers, the folks in the room here at the Yotel. Look, we cannot sleep on the folks who make this all possible, who do this work every day, who gave you those wonderful bag lunches, who made sure that this room was nice and prepared, our technology folks, our consultants, everyone who worked with us. Please join me in thanking all of those folks. And again, You got to thank my wonderful team. I know you all have been with them all day. Anytime anybody had an issue, I know with a smile on their faces, their collective faces, they helped you and answered your questions and did what needed to be done. So please, again, thank the wonderful staff at the Congressional Black Caucus Foundation. And I'd like to thank our other sponsors, again, Gilead Sciences, Fresenius, LHC Group, Genentech, Ardelyx, and Harmony Biosciences. Thank you so much for all of your support for us and for this event. And to those wonderful vendors who were in that room, who put out their tables, who put out pamphlets, who talked to you all about these incredibly important issues that related to our topics today. I want to thank them as well. AAMC, HHS, the National Kidney Foundation, the National Medical Association, the National Psoriasis Foundation, PPMW, and Unity Healthcare. Thank you all for your work and for making our vendor room so successful today. You all see, I rarely look at notes, but I got to look at notes when it comes to the people I have to thank, because I don't want to forget anybody. And you all know those moments where they say, blame it on my head, not my heart. I could say that, but you will still remember that I forgot someone, and I don't want to do that. So thank you all. Let me leave you with this. We have a charge. We have a charge. To whom much is given, much is expected. To whom much has been given, much is expected. I expect all of you to continue this work, to continue these conversations, to continue reaching out to communities, to continue reaching out to us. And more than that, I expect you to hold us accountable. If we are not doing the work that we told you today we do, and that we're committed to, and that we are pledged to doing, if you have ideas that you want to incorporate, please reach out to us, continue to partner with us, continue to be a change agent with us. That is my charge to you today. When you see me on the street, I expect you to stop me. Please don't be one of those people who says, oh, she won't remember me. No, I want you to stop me. Stop any member of our team and say, I was at your health summit. Here's what I've been doing since then. Here's what's been happening in my community. Here's what I want you all to know. Can you all be a part of it? That is how we create change. The work has to continue. And so my charge to you is that you all go out and you continue making a difference. And in the words of my personal hero, the late, great Representative John Lewis, get into good trouble. This is all good trouble. There are people who don't want us to do this work. There are people who don't want us to talk about the statistics that we talked about today, that our Johnson & Johnson representative, Dr. Lamont, talked about. There are people who don't want to hear that Black and brown communities are suffering, but I don't care. We're going to speak it, we're going to talk about it, and we're going to make a difference. So go out, get into good trouble, and continue doing all that you do and ensuring that our communities and the people who don't have these opportunities to sit in these rooms, who don't have opportunities to stand at a podium like I have the privilege of doing today and talking about what's going on in their communities, continue to not only be a voice for them, but create a space for them to be their own voices and to raise their own voices. So thank you all. We appreciate you so much, and we look forward to the work continuing and to seeing you at future events and to seeing you in rooms with us where we will continue to get into good trouble. Thank you all and enjoy the rest of your afternoon.